Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Well, hello once again. This is our first podcast in the new year, and we're very glad to have you all out there. This is Howie Horrocks, and I got my good buddy and partner Mark Dilatush on the line. How you doing, Mark?
Hey, Howie. Happy New Year.
Hey, same to you.
Was Las Vegas its usual during the New Year festivities?
Yeah, 250,000 extra people in, shoulder to shoulder. Of course, I didn't go down there, but
right.
Yeah, I heard about it. It was awesome.
There you go. Just like Halloween on the Strip, I would imagine.
Exactly.
Okay, so this is our first. Well, first I want to before we start into 2017. I think 2016 was a little weird. I mean, it was a little weird for a lot of dentists. You know, a lot of our clients and a lot of dentists who aren't our clients because they still reach out to us and talk about their practices. And I think a lot of that had to do with a presidential election cycle. I think everybody who had a slow September and October, normally your Octobers aren't that slow. Normally right. October's a really good October. I think if you go back a few years, maybe four years to be exact, you might find that the same exact thing happened during a presidential election year. I think it happens to dentistry every presidential election year, and 2017 is not one. So, so by default, you should look upon 2017 with a little more light at the end of whatever tunnel you're going down than the darkness. So anyway,
I think it's the unpredictability. No matter how you wanted the election to come out, the fact that it's now over and we can sort of deal with what we've got,
right?
It kind of calms things down, I think. So
exactly, and it calms it down for you, and it calms it down for your consumers, and calms it down for your patients, and calms it down for everybody. So yeah. Anyway, so 2017. What do we got for 2017, Howie? What are we doing today?
Well, the obvious thing is at the first of the year is what are you going to resolve to do in your dental practice for this upcoming year? So I don't like to talk about resolutions, more like intentions. How about that? Good intentions for 2017.
Okay, that sounds good. All right, 2017, good intentions. Far be it for us to have our audience take our resolutions and commit to them. So we'll call them intentions. The first one goes way back. I mean, way back. Goes all the way back to when I was consulting, really. And so difficult to get dentists to commit to this, but it's almost 100% acceptance once they commit to it and do it.
Oh yeah.
And that is, we would ask you to commit to calling your new patients the day your new patients call to make their first appointment.
Right.
The process is very simple. Someone at your front desk is likely writing down a list of patients that you need to call at the end of your day on your ride home, who may have had kind of a procedure that may have been painful. They may have some post-op discomfort, what have you, just to check in on them and see how they're doing. And what your front desk person would do is simply add the new patients that called that day to make their first appointment in your practice, or the patients who scheduled online and made their first appointment in your practice. Add those people to the list with their phone numbers, call them. The conversation is very easy. Says, hi, this is Dr. Dilatush. You made your appointment at my practice your first appointment at my practice today. Howie, how are you? Are you currently experiencing any dental pain?
Yeah, a little bit.
No, you're not, because I would have known that because it would have been an emergency. Okay.
I know. I was
You're
testing.
not playing along, Howie.
No, I'm doing great, doctor.
Yeah. Okay. There you go. No. Yeah. I'm doing great, doctor. So, okay. I didn't. Mary hadn't noted whether or not you're experiencing any pain. I'm glad you're not in pain. Do you have any questions about your appointment at 3:00 on Thursday? Do you need directions? Do you know where we are? Do you know where the parking is? Do you have any questions for me?
No, I Googled you. I know where you're at.
Oh, okay. Well, I'm really looking forward to meeting you, Howie, at Thursday at 3:00.
Wonderful. Hey, thanks for calling. I've never gotten a call from a dentist before.
Oh, I'm a pretty amazing dentist. I'll see you Thursday.
Okay. Bye.
All right. See how that goes, guys and gals out there in dental. It's really simple.
Yeah.
Are you currently experiencing any pain? I don't have that note here. The person's going to say no, because if they were in pain, they'd be in an emergency and they'd be in your schedule, right? Or your staff would have noted it on your list to take home.
Right.
These calls take maybe 1 minute, minute and a half.
And you know what else is the benefits of this are not lost, even if you have to leave a voicemail, which you probably will. Right?
Yeah, many times you will, and you just ask the same question. I don't have a note here. I understand you made your first appointment at my practice today. I don't have a note here to tell me if you're currently experiencing dental pain. If you are, please give me a call, or if you just like to chat, give me a call. My number is blah, 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 blah.
Right. It makes you more accessible. It makes you friendly. I mean, just like in our example, I mean, how many dental patients get a call from their dentist on the day they make the appointment? Not enough.
Right. Not enough is the right answer. Okay. Now, there's a couple of other things here that are maybe hidden, maybe subliminal. If you want to jack up your marketing in 2017, you'll start doing these little things, because it's a pile of these little things that makes everything successful. Trust us. It's not just us. Okay. Our best clients are partners with us. They do these little things. Okay. Our work gets the phone to ring. Their work gets the patient committed, gets the patient the treatment they deserve or they need, and gets it done well. I mean, we're all partners in this whole process, right? These little things that we're just throwing into this podcast today they're not difficult. They're things you can change Monday. Really, you can change every one of these on Monday. And it will absolutely help you get more out of whatever marketing dollar you're spending. Even if you're not spending your marketing dollars through us, that's okay. No big deal.
Yeah.
Implement these things and you will. So hidden within this, though, is we have clients now who are getting new patients, obviously calling the practice, but they're also getting new patients who are scheduling their first visit online. Those notifications immediately go out to the staff, and those people should be put on this list as well. Some people who think online scheduling replaces the need for those conversations, those people are wrong. Online scheduling simply allows those conversations to happen during a time where people can focus on the conversation and not what else is going on in the practice. So online scheduling does not replace these conversations, it accentuates it. So you call all those patients as well on your way home. And again, if it sounds onerous, it's not. Unless if you're in a single doctor practice and you have 20 new patients a month, that's one a day. Even if you have a great day and there's 3 or 4 new patients who call and made their first appointment today, what's that, 10 minutes on the phone on the way home? It's not a big deal. It really isn't a big deal. But it will pay dividends. Your no-show rate will go down to almost 0, and your new patient will walk in a different kind of person because they would have already met you.
Yep.
Okay, you're creating that relationship, and you're minimizing the chances of the person going elsewhere. Let's say they have a scheduling conflict. They're going to feel a little weird having met you. about canceling the appointment or moving the appointment. They're going to keep that appointment, right? So anyway, that's one. What's number two, Howie?
Well, just to put it succinctly, you want to be able to say yes a lot, and you want to be able to do treatment on your patients today if possible.
Right. And this may involve technology. It may not involve technology. I know our CAD-CAM dentists, we probably promote same-day dentistry more than anyone on the planet. Okay.
Yeah.
Even Serona. Okay. But you don't have to have CAD-CAM in order to. Here's the sentence that we want you to practice. It's a question. It's not even a statement. It's a question. Patient, would you like us to take care of that today while you're here? That sounds like a pretty easy question, doesn't it, Howie?
Yeah, yeah.
And from the patient's perspective, let's see. I'm here.
Yeah.
They got this stuff in my mouth anyway. They're sucking my spit out. I have a bib on. I'm reclined in a chair. Yes, I want you to do it today. I don't want to take another half a day off from work, right? I don't want to have to make all these arrangements, get coverage for my kids or whatever the issues are. Yeah, please finish it today. Okay.
Yeah. Just so we don't get accused of keeping the obvious to ourselves, it's really convenient for them.
Yes, yes. So, but it's so incredibly difficult for some our clients included, right? Yeah. Some of our practices to actually alter their schedule. It's like somebody with a hammer and a chisel made their schedule and it's locked in stone, never to be ever altered, right? In other words, you can't deviate from the path you're on at all, right? So no, that's not right. So how do you do that? How do some practices say, would you like us to take care of that today while you're here? How come some practices ask that question and some practices don't? And you look at really two main things, the schedule and the human beings in the office. Those are the two things. Because with the dentists, most dentists, not all, there's some dentists who want to be structured. They want to look at their schedule. And if anything changes on that schedule, they, for the lack of a better word, freak out, right? Because something changed.
Yeah.
All right. Now, I'm currently not talking to those dentists. Okay. If you're not in that category and, emotionally, it's okay if things change, and financially you want to give you and your team the best odds at hitting your daily production goals, man, the best way to do that is to ask that question. Okay. If you have somebody in hygiene and it comes out, you take a periapical for the first time in a year and you see an abscess and you say, well, this tooth is definitely going to need a root canal. We can start it today or we can get it finished today. Would you like us to handle this while you're here? If you can actually do that, you're going to add production to every day in your schedule. Now, I understand that you need room, you need operatories, and you need a team who's with you, a team that buys into the process, a team that is willing to shift around their lunch hours for the betterment of the whole practice, a team that's not going to freak out if they have to go get a root canal tray, okay? A team that is part of the process and not part of the problem.
Right.
All right. But I'm telling you, it's amazing. No, same marketing, no different. Okay. Same number of calls, same call volume, same call length, same everything. Okay.
Same expense.
Same expense. It's amazing to see the difference in ROI pool with the practice, ROI generation, with the practices that will ask that question versus the ones who won't, who have to live through a structured schedule every day, right? So we're just sharing with you, and we're not asking for your commitment. Here's the one commitment I'm asking you to think about it in 2017. That's probably going to be, I mean, calling your new patients at the end of the day, you can do that. You can start doing that Monday. And thinking about doing same-day treatment, you should start thinking about on Monday. It may take you a little while to plan it, work with your staff on it, talk about the scheduling, look at the operatories, figure out how this is all going to work operationally. But start thinking about that on Monday. How can I be the dentist in my area that says, would you like us to take care of that today while you're here?
Yeah.
With every patient that needs treatment that's coming out of new or coming out of your hygiene chair. Why not?
Yeah.
Right? So that's number two.
That's number two. Before we get to number 3, we're going to take a short break. We'll be right back. We hope you're enjoying our podcast. Let me ask you, do you have a roadmap for your marketing? Why not let New Patients Incorporated do it for you? Our marketing plans have been proven effective for over 27 years for hundreds of practices across lots of different countries. We will give you the marketing data for your area, a marketing budget. We'll show you how to allocate your budget, and then we will show you the proper deployment strategies for each medium. Click on the header where it says Complimentary Marketing Plan when you go to www.newpatientsincorporated. All right, we are back. Thank you. We've got one more thing, and one more, what do we call these? Intentions for the new year, Mark?
Yeah, we called them intentions. I'm calling them commitments.
Okay, let's do that.
Commitments.
All right. And what might the third and final one for today, anyway, be?
Oh, gosh, please, if you're our client and you're listening to this, please commit to listening to your phone calls.
Okay.
Please don't commit someone else on your staff to do it. Really. I mean, at least listen to your marketing. The phone calls I'm referencing are phone calls that they're calls that are coming in off of your marketing. These are mostly new patient phone calls. Out of the total call volume, 45% of the calls will be new patients. The other 55% will be repeats and probably a couple salespeople in there somewhere. But here's why I'm asking you to commit to this in 2017. The best way for the doctor to truly understand what patients are asking the staff, how the staff is reacting to those patients, how many calls they're missing because they don't allow their scheduling to be done online, how many calls are going to voicemail, how many new patients they're losing. Oh my goodness, the pyramid of information that you can derive from listening to your own inbound new patient calls. It's voluminous. It's my new favorite word, Howie. Voluminous.
Oh,
okay. I know. You love that word. Okay. Yours is revelatory. Mine's voluminous. All right. So
revelatory.
Sorry. Whatever.
Who's count?
Yeah, it was close. So, here's what bugs me about those who won't commit to doing this for at least 60 to 90 days and until they get their house in order, right? Because almost none of you have your house in order, yet you won't commit to clicking on. It's almost like the 3 monkeys, the see no evil, hear no evil, speak no evil monkeys, right? It's like you don't want to hear it. But I'm asking you to commit to listening, okay? Commit to listening so that you can take corrective action that Howie and I know is there, that needs to take place in order for you to get more out of your marketing dollar. Again, whether or not New Patients Inc. puts that on the street for you or some Bob's marketing company does is irrelevant. Either way, you're going to get more from whatever marketing spend you're doing right now if you will all just commit to listening to the interaction between your newest patients and your staff.
Right. And by actual tracking result, we know that 19.8% are going unanswered. That's certainly probably the first corrective measure you take, but also in the way that whoever's answering the phone is dealing with the new patients. You want to hear that. You want to know what that conversation is like, because it's the most important conversation in your practice.
Yep.
Because there's nothing that happens in a dental practice of a revenue consequence until and unless the phone rings. And then what happens after that is the most critical time. So you would do yourself enormous amounts of good if you knew what was going on during that phone call.
Yeah, and none of these commitments or resolutions for 2017 cost any money.
Yeah.
Right? Okay. We purposely wanted to start your 2017 out costing you no more money. We're not going to hold to that throughout the whole year, okay? But that
won't prevent you from sending us any checks. But,
that's right. That's right. But we want you to, just start out with just those 3 items: calling your new patients the day they call to make their first appointment, or they schedule online their first appointment. Saying to your existing patients, would you like us to take care of that today while you're here? Just say that when they need some work rather than rescheduling them. See if you and your staff can rework the schedule, work like a team, add that production to your daily schedule. And please commit to listening to the call tracking calls. Don't delegate that to the person who's likely making the most mistakes, which is the person at your front desk. Okay? Listen to them yourself. Judge for yourself. Look at the data yourself. If you're one of our clients and you have a question about how to do that, or what, ask us, would you listen to this call and let me know if you think this is good or bad? We'll do that with you. That's fine. Okay? But none of this happens unless you take action, unless you're willing to listen yourself. And you know what? What's the worst thing that could happen? You listen to them, your staff's doing a great job, you're not missing 20% of your new patient phone calls. The worst case scenario is you feel awesome about you and your team and your performance, and you move on. Yeah. That's the worst case scenario. Okay. So even that's good, right? Anyway. Those are our big 3 resolutions for 2017. We chose them because of their profound impact statistically between our client offices. If you line up our client offices that do those 3 things, and you line up our other client offices that don't, and then you line up the number of calls and the length of the calls for call quality, and you see the production on the left versus the right, it's amazing.
Yeah, it's like maximum reward with minimal effort and no cost.
You got it. You got it. All right, give us a snappy close, Howie.
Well, thank you for listening. We certainly enjoy the audience that we've attracted here. We love all you guys and gals out there. And we hope you have a marvelous new year, and we'll see you again soon.
We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.